Co-Occurring Disorders, Diagnosis and Treatment by Brittany Coronado of Mercer University. Substance misuse by individuals with a chronic and serious mental illness such as schizophrenia or bipolar disorder is a growing problem, with studies showing that nearly 50% of all people with serious mental illness have met the criteria for a substance use disorder in their lifetime. Dual diagnosis was originally discovered to be a crisis in the 1980s, and according to the World Health Organization and the United Nations Office on Drugs and Crime, dual diagnosis is defined as a person diagnosed as having an alcohol or drug use problem in addition to some other diagnosis, usually psychiatric, such as mood disorder or schizophrenia. About 50% of individuals with severe mental illness will develop a substance abuse disorder. Currently, it is estimated that anywhere from 32 to 85% of people with mental illnesses also have a substance abuse disorder. Here we have a bar graph showing the prevalence of drug disorders among people with mood and anxiety disorders. As you can see, there is a high correlation between the two. Why might someone with a mental illness abuse substances? Self-medication. Substance abuse often begins as a means to alleviate symptoms of mental illness. An example of this would be someone who's experiencing a manic episode using alcohol as a depressant, or someone who's very depressed using a stimulant to bring themselves up. Causal effects. Substance abuse may increase vulnerability to mental illness. And common or correlated causes. The risk factors that give rise to mental illness and substance abuse may be related or overlap. All substance abuse and behavioral dependencies have the following behaviors in common: compulsive use without control, continued use despite negative consequences, and obsession with using or obtaining the drug or behavior. Why do drug abuse and mental disorders commonly co-occur? Some factors are overlapping genetic vulnerabilities. Mounting evidence suggests that common genetic factors may predispose individuals to both mental disorders and addiction, or to having a greater risk of the second disorder once the first appears. Also, overlapping environmental triggers, stress or trauma such as physical or sexual abuse, and early exposure to drugs or common factors that can lead to addiction and to mental illness, particularly those with underlying genetic vulnerabilities. Also, involvement of similar brain regions. Some areas of the brain are affected by both drug abuse and mental disorders. For example, brain circuits linked to reward processing, as well as those implicated in the stress response area, are affected by abused substances and also show abnormalities in specific mental disorders. Drug abuse and mental illness are developmental disorders. They often begin in adolescence or even childhood, periods when the brain is undergoing dramatic developmental changes. Also, early exposure to drugs of abuse can change the brain in ways that increase the risk for mental illness, just as early symptoms of a mental disorder may increase vulnerability to drug abuse. For those people who have a diagnosis of a mental illness, the abuse of substances such as alcohol and illicit drugs complicate the care they receive and may have an adverse impact on care outcomes. All substance and behavioral dependencies have the following behaviors in common. Individuals who suffer from co-occurring mental illness and substance abuse are more likely to suffer from functional impairment, more behavioral problems, and an increased risk of HIV or a hepatitis infection. And this could even possibly lead to a triple diagnosis of illnesses such as HIV or hepatitis and substance abuse disorder and mental illness. Substance abuse and dependence in people with serious mental illnesses are especially detrimental because of the complex interactions between the two problems and the impact on treatment, engagement, and outcomes. Some examples of this are non-adherence with medications, an increase in symptoms, rehospitalization, poor social adjustment, and worse prognosis. These are just a few of the adverse consequences associated with dually diagnosed patients. And moreover, the treatment of individuals with either or both of these disorders is often characterized by a lack of therapeutic engagement, problematic motivation for change, and relapse after some initial successful change. Clients with mental illness who use or abuse substances require long-term coordinated assistance to manage their addictions better, to improve their overall mental health and general well-being. Research has shown that users of stimulants such as amphetamines are characterized by higher substance use disorders as well as psychotic illnesses. With diagnosis, drug and or alcohol abuse combined with mental illness can be very complex for therapists or counselors to diagnose. The high rate of comorbid substance abuse and mental illness points to the need for a comprehensive approach that identifies, evaluates, and simultaneously treats for both disorders. The use of standardized testing instruments can be very helpful in assessing these co-occurring disorders. Research has shown that there are 5 main assessment tools that are seen as most helpful and useful in diagnosis. The Substance Abuse Subtle Screening Inventory, there's also a form of that can be used for adolescents. The Beck Depression Inventory, the Minnesota Multiphasic Personality Inventory 2, Addiction Severity Index, and Michigan Alcoholism Screening Test. The BDI actually and the MMPI-2 are primarily used to detect mental and emotional disorders rather than addictions typically. And while these assessments are currently being used to diagnose individuals with co-occurring symptoms, with some success, more research into detecting these disorders is necessary. The detection rate of co-occurring mental illness is typically around 20% for individuals being referred with mental health treatment. Methadone maintenance clinics have shown to have the lowest detection rate, but the highest referral rate. Male, Hispanic, and African American patients, as well as those who use heroin, have been in the criminal justice system, have a higher risk for mental illness not being detected. And once detected, African American patients, heroin users, and patients in the criminal justice system are less likely to be referred for treatment. With better and more accurate detection of co-occurring disorders comes better, more individualized and integrated treatment. Careful diagnosis and monitoring will help ensure that symptoms related to drug abuse, like intoxication and withdrawal, are not mistaken for a mental disorder. Even in people whose disorders do not occur at the same time, research shows that mental disorders can increase vulnerability to subsequent drug abuse. Drug abuse also constitutes a risk factor for subsequent mental disorders. Therefore, diagnosis and treatment of one disorder will likely reduce the risk for the other, or at least improve its treatment outcome. The need for development of effective interventions to treat both conditions together is strongly supported by research. Experts have argued that there is no typical client with dual diagnosis, and substance abuse could be primary or secondary to the mental illness, or in some cases be independent of the mental illness altogether. Treatment plans have been largely theoretical with a combination of meetings or 12-step programs along with traditional interventions. It's essential for treatment facilities to incorporate both substance abuse and psychiatric treatment. It should also implement holistic treatment, including employment skills for opportunities to learn how to write resumes or interview skills in order to seek employment post-treatment, relationship support, including the family or friends involving them in treatment and teaching them relationship skills, treatment for internal problems such as anxiety or depression, and the use of possible medications to assist in withdrawal symptoms. Some challenges to treatment include the fact that during the first 90 days of abstinence, the risk of relapse is very high because during this time the brain is going through significant withdrawal and is very, very vulnerable at this time. Other challenges include denial, the social stigma that is associated with substance abuse and mental illness, and in many cases boredom, which may end up causing an individual to relapse. Throughout this treatment, there are multiple stages of change. The first being pre-contemplation, or the stage where the individual is not ready to change. People are not intending to take action in the foreseeable future and can be unaware that their behavior is problematic. The contemplation stage is next. That's the kind of getting ready stage. People are beginning to recognize that their behavior is problematic and start to look at the pros and cons of their continued actions. The next is the preparation stage, or the ready stage. People are intending to take action in the immediate future and may begin taking small steps toward behavior change. Then we have action. People have made specific overt modifications in their behavior and are seeking new healthy behaviors. Maintenance stage, people have been able to sustain action for a while and are working to prevent relapse. And then the termination stage is when individuals have zero temptation and they're sure they will not return to their old unhealthy habits and are just in recovery. Still, behavioral treatment options customized for a given age group or gender have shown promise for treating drug abuse and mental disorder comorbidities. Clinicians and researchers generally agree that broad-spectrum diagnosis and concurrent therapy, including pharmacological and behavioral, will lead to better outcomes for patients with comorbid disorders. Then we have prevention, and this is a list of prevention programs to reduce risk factors, including a reduction in ineffective parenting, chaotic home environments, a lack of mutual attachment or nursing, inappropriate behavior in the classroom, failure in school performance, poor social coping skills, affiliations with deviant peers, and overall perceptions of approval of drug-using behaviors in the school, peer, and community environments. And we have a Substance Abuse and Mental Health Services Administration. The website listed here promotes prevention, and their viewpoint is that they should create communities where individuals, families, schools, faith-based organizations, and workplaces take action to promote emotional health and reduce the likelihood of mental illness, substance abuse, including tobacco and suicide. This initiative will include a focus on the nation's high-risk youth in tribal communities, and military families. And that concludes my presentation about co-occurring disorders, diagnosis, and treatment.